So today we will study the link between dopamine and depression and anxiety. So the traits considered are those negatively related to the dopaminergic function in both value and salience systems. So there is an aspect of neuroticism which is labeled withdrawal and which is strongly linked to plasticity. So withdrawal is a grouping of anxiety and depression in a single trait dimension, and it is consistent with the clinical research showing that risk for diagnosis of depressions and general anxiety disorders overlap very strongly. The connection of the withdrawal aspect of neuroticism with low plasticity is consistent with lexical research, in which the dynamism factor that appears when only two factors are extracted is related to withdrawal. An absence of depressed or anxious affect appears to be importantly related to plasticity. Neuroticism is considered to reflect the primary manifestation of sensitivity to threat and punishment. In Gray's system, neuroticism is the result of the joint sensitivity of the BIS, so behavioral inhibition system, and the FFS system, flight, freeze, fight system in response to threats. Variation in FFS sensitivity is not hypothesized to be related to dopamine. The BIS produces passive avoidance, inhibiting behaving and increasing vigilance and arousal in response to increased psychological entropy. The BIS operates by inhibiting approach towards the goal in question. In other words, it is antagonistic to the BAS, suggesting BIS sensitivity may be negatively associated with activity in the dopaminergic system. Anxiety is a state in which the possibility of punishment has not entirely overcome the possibility of reward, such that the goal in question is still potentially attainable. In contrast, depression is a state in which punishment is perceived to be unavoidable, which can be described cybernetically as a state in which a goal and therefore a reward is perceived to be unattainable. Dopaminergic function is diminished in depression. The symptoms is linked to dopamine. Anhedonia, the most clearly negatively associated with extroversion. Anhedonia is the low extroversion and high neuroticism. In this case, there is a reduced dopaminergic function. Both the value and the salience systems thus seem likely to be influential in depression. In relation to salience, depression is associated not only with reduced motivation in general, but also with cognitive deficits. As for anxiety specifically, association of anxiety with a dopaminergic function is more ascertained than for depression. High motivation, which provides the clearest evidence for depression involvement in dopamine involvement in depression, is not central feature of anxiety. Although dopaminergic function may be negatively associated with withdrawal, which represents a general tendency toward passive avoidance, only depression is likely to be associated with dopamine. With dopamine. If one considers anxiety without controlling for depression, however, anxiety may appear negatively associated with dopaminergic function.